learners, this is Dr. Ruchika Kuba, Director, School of Health Sciences, and your course coordinator for this course on lifestyle and non-communicable diseases. You have already learnt about the various mental health diseases and the interrelationship between mental health and non-communicable diseases. Let us now talk about lifestyle modifications for mental health. We have with us Dr. Nitin Raut, who is the psychiatric specialist from Lady Hardinge Medical College, New Delhi. Welcome, Dr. Nitin.
Thank you very much, madam, for inviting me, and a very good afternoon to all the learners.
Now, let us begin with discussing what are the expected learning outcomes that you are going to do in this session.
As we are aware that lifestyle and mental health are very closely related and linked. So I hope that after this module, the learners are able to understand what lifestyle factors are, the need of their modification for mental health and illnesses. They should also be able to identify key modifiable factors that influence mental health significantly. They should also be able to discuss its effect on mental health as well as mental illnesses. Further, they should be able to discuss what are the various strategies that are evidence-based and available to modify these lifestyle factors. And lastly, but not the least, I think they should be able to apply these practical approaches to improve mental health through application of these lifestyle interventions. So these are the learning objectives of this module.
We have learnt in our previous sessions that lifestyle can be defined as an individual daily behavior and habits, including physical activity, diet, sleep, stress management, substance abuse, screen time, and social interactions. These factors together influence the overall well-being and health outcomes. We also know now that the lifestyle modification involves making deliberate changes in this pattern of behavior to improve physical and mental health. It includes adopting healthier practices, eliminating harmful ones, and making efforts to maintain these changes. So, Dr. Nathan, what do you think? Why is there a need to address lifestyle modification for mental health?
Ma'am, as we all know, as I told you, that mental health and lifestyle modification have a very close but complex relationship. They have, in fact, a bidirectional impact. So, meaning that there are certain lifestyle choices that can worsen mental health problems like poor sleep, poor diet, or stress, or excess screen use, etc. While healthy lifestyle improvements can positively impact both illnesses and healthy individuals. Secondly, many of the lifestyle problems like obesity, diabetes, they can often coexist with mental health problems. So when they occur together, they worsen the outcome for each other and also pose a problem in management of each other. And overall, they increase the health risks and mortality rates. Thirdly, sometimes there are certain psychotropic medications which are prescribed, which can increase appetite, cause weight gain, sleep, increase sedation, poor energy levels. So these can all adversely affect certain lifestyle factors. And lastly, many of the lifestyle modification factors form a very, very important part of psychiatric treatment like structured physical activity, proper nutrition, sleep hygiene, yoga, meditation. These all are essential components of many psychiatric treatment and approaches.
Now, what are the various lifestyle factors? You have named a lot of them, but what can you list them again that have a significant impact on the mental health diseases?
So, the most key lifestyle factors that I can think of are physical activity, nutrition, sleep, stress, substance use, and screen time, and newer factors are emerging as we speak.
How does the physical activity impact the mental health, and how can we modify it for the mental health well-being?
So, I think I will answer this in two parts. Firstly is why there is physical inactivity in mental illness. So, there are few reasons for that also. Firstly, there are certain symptoms of illnesses like depression, anxiety, even serious mental illnesses, which involves poor energy, reduced interest in doing anything, poor motivation, and sedentary behavior. So all these symptoms contribute to physical inactivity in mental illness. Secondly, there are other types of symptoms like poor social interaction, isolation. These are all symptoms which can again be a part of all these mental illnesses that I mentioned, which can also reduce the engagement in physical activities. Thirdly, there are certain psychotropic medication, as I said before, that they can cause weight gain, cause sedation, daytime drowsiness. So side effects like that also further reduce the probability of a person engaging in physical activities. So naturally, if a person engages in physical activity, there will be symptom reduction if they have already a mental illness. And if a person has both mental illness as well as one of the non-communicable disorders, so outcome of both will be improved if a person engages in physical activity. And overall, even if anyone doesn't have any illness, physical activity is good for overall health and well-being.
So that means that at least one starts feeling better, and one stops feeling sick, because mental health itself is how you actually feel about yourself. Now we have learnt about WHO recommendations for physical activity in our previous sessions, but with respect to mental health and disease, would you like to give some important points for the physical activity?
Yes, ma'am. So as I said, specific to psychiatry, 2 points I want to highlight. Firstly is that, as I said, that some of the symptoms can reduce the engagement into physical activities. So ensuring that the person takes appropriate psychiatric treatment, adheres to the treatment, and maintains a symptom-free state. This would improve his energy levels, his motivation for engagement in physical activities. And secondly, sometimes the patient may have increased symptoms, so he may require medication which help in sleeping. But when a person is symptom free or does not have such symptoms, he can always ask his psychiatrist that his medication may be changed and who have a lower risk of sedation, so that he can engage in physical activities. So these are the 2 points which I think are relevant from psychiatry point of view.
Okay, now coming to another important lifestyle factor, that is nutrition. How is diet and nutrition very relevant to mental health and disease?
So ma'am, as we are aware that healthy diet is a very important part of health and well-being. It is essential for all the individuals, whether healthy or having mental illness. But if a person has a mental illness, managing the diet or keeping it healthy will reduce the risk of other co-occurring disorders like diabetes, obesity, hypertension, which can then reduce the outcome or worsen the outcome of both of them. Now we have evidence that there are certain nutritional deficiencies like vitamin D and vitamin B12 deficiency, for example, and they have been linked to mental illnesses like depression, anxiety, or other severe problems. So sometimes taking care of just these deficiencies can treat the illness. Nowadays we also are talking more about processed food because the intake is increasing gradually, the fast food intake is increasing, and consumption of fast food is linked to development of all the non-communicable disorders, including mental illnesses like depression, anxiety, sleep problems. So I think that's why nutrition and mental health have a very significant close relationship.
So that means it is both ways. I mean, as you said, some of the deficiencies can be caused by the nutrition and diet, which can result in mental health, depression and all. And also, if one is not taking certain diet like vitamin D and all, then they can also get into mental depressive illnesses. Now, why and how can we modify what we eat so that we remain mentally healthy?
So now, as I told you them that certain deficiencies can cause mental health problems. So addressing them using a balanced diet which has all the essential nutrients become a mandatory step. Secondly, as we already discussed, that many of the comorbid problems like problems with mental illness may also have obesity, diabetes, hypertension. So if we take care of the diet, we will also be taking care of these non-communicable diseases which exist along with mental illness. So if a person either healthy or with mental illnesses modifies their nutrition according to guidelines, I think they will have improved overall health and well-being and quality of life. I think a few things additionally for mental health perspective I'll be talking about. First is Mediterranean diet. So it is nothing but a diet which is rich in fruits, vegetables, whole grains, legumes, and which is rich in omega-3 fatty acids. So constituents from this diet will help you reduce inflammation, slow the aging process, reduce the risk of common mental health problems. There are also certain micronutrients which are also essential for normal brain functioning, mood stability, and cognitive health. So, having components from this Mediterranean diet will help us a long way. Secondly, there is something called as gut-brain connection. So, our digestive system and brain are closely related because gut is involved in synthesis and metabolism of certain brain chemicals like neurotransmitters. So, when our gut has enough of healthy bacteria and less of unhealthy bacteria, it functions at its optimum and is able to perform its function of this metabolism of neurotransmitter, which indirectly will reduce mental health symptoms also.
I think sleep is also another very important lifestyle factor which you had mentioned before also. What is its role in mental health? Is there any scientific basis or yeah?
So, yes, sleep is actually a very significant part of mental health itself. So, firstly, sleep as for physical activity and for diet is adequate sleep with adequate quality without interruption is necessary for maintaining our mental health. Sleep disturbance is often a symptom of many mental illnesses, and it is often the first symptom to appear in conditions like that. Also, chronic sleep deprivation due to various reasons, maybe work-related factors or other factors, can lead to a lot of non-communicable diseases, including depression, anxiety, in addition to obesity, cardiovascular diseases, etc. So, I think this is the connection in relation to sleep and mental health as far as psychiatry is concerned. We should also take care of associated disorders. Sometimes there are disorders like sleep apnea, which causes difficulty in management of sleep. So, we should take care of that also. So, in this way, sleep and mental health are very, very closely related.
Although improving the sleeping habits has been dealt in other sessions also, but would you like to tell us some ways in which we can improve? Because it's a very important thing, and with the changing times, with the technology coming in, with the time zones getting obliterated across the globe, people are working for other countries and also engaging in so many activities around the clock that the sleep is getting affected for a majority of the people. So, what are your recommendations for the sleep?
So, I think the detailed recommendation of requirement, how much should be required, I think this must have been covered in previous module. So, I'll stick to what is relevant for psychiatry. So, as far as psychiatry and sleep is concerned, the first thing that comes to mind is medication selection. So, I think when a person has mental health problems, he may be prescribed certain medication. So, it is important that we treat the sleep problems adequately, not under-treated or over-treated. Secondly, the person should ask for medication which will not cause any daytime drowsiness. It may prevent him from engaging in other meaningful activities. Also, use of such medication should only be under supervision and only for a period for which it is prescribed. And again, treatment of underlying disorders like sleep apnea is also important. In addition, I also think that psychoeducation about sleep, that why is it necessary, what should be done to maintain it, what are the normal sleep hygiene measures that one can use, that is also important. Secondly, we can nowadays use lot of devices, even our mobile applications, to track our sleep, track what are the problems, what are the disturbances in our sleep, and adjust or manage them accordingly. So, these are some of the things which are relevant to psychiatry.
But still, I think the thing to stress on is that sleep hygiene should be adhered to and not medication. Medication is the last resort, and especially only for those who, for it is not getting managed by sleep hygiene, or if there is an associated mental health problem. Now, stress is another one lifestyle factor that is being talked about a lot, and it is increasing in our everyday, day-to-day life. How does stress affect mental health?
So, I think we all always talk about stress, how it affects all the illnesses, how it affects mental health. So, I'll be specific about how it affects mental health. So, there's enough literature that chronic stress is a major risk factor for causation as well as persistence of mental health problems, common mental problems like depression, anxiety, sleep disorders. and it causes this by disruption of brain chemistry, increasing stress hormones, and a lot of other biochemical changes. Stress is also responsible for a lot of other comorbid illnesses which occur with mental illness, like we've been talking about this, like obesity, diabetes, hypertension, other chronic diseases. These are all triggered by stress, which causes inflammation, hormonal imbalance, and also leads to unhealthy coping behaviors like poor diet and physical inactivity. So in this way, stress and mental health are related. So it is very necessary to identify when the stress goes above the what we can
Tolerable levels.
tolerate. Yes. So some amount of stress is beneficial for performance, but we should identify the distress or warning signals, and we should take stress management strategies when we think it is going out of our capacity.
And what are the important practical considerations for managing stress?
So stress is a very, very subjective factor because the stress factors depend upon a lot of things like genetic makeup, psychological makeup, environmental factors, work, family. But there are certain strategies which may be useful for all the individuals. So basically, whatever lifestyle factors till now we have discussed, like physical activity, nutrition, sleep, that should be managed optimally. Regular exercise will reduce cortisol levels and improve stress resilience. Also, other mind-body practices like yoga, meditation, they help a lot in improving emotional regulation, and they also help enhancing our overall capacity to deal with stress. Also, having a structured daily routine, activity scheduling provides stability in the routine and reduces uncertainty, because uncertainty is one of the common reasons for stress nowadays. And lastly, as I said, the stress management strategies should be personalized and tailored according to the stress that the person has.
I think this is a very common, everybody must have experienced this in their own lives also, that when they are having uncertainty, as you said, when they don't have a structured life, then there is more stress. And during stressful situations, if they can just disengage and go for a walk, or just do a little bit of a yoga or meditation, it does help a lot. So it doesn't precipitate into a mental illness. You could be having some stress, but you don't go ahead to a mental illness. But persistent stress with a lack of sleep can result in mental illness, which is increasing now so much in the nowadays world. Now, but is there also increasing cases of substance abuse is also coming to light, and is there any relation between substance abuse and mental health?
Yes, ma'am. Substance use and mental health have a very significant relationship. In fact, substance use disorders are now classified under mental health problems. Apart from that, substance use like alcohol, cannabis increases the risk of developing mental illnesses like depression, anxiety, even severe mental illnesses. It also contributes to other non-communicable diseases which can increase the comorbidity levels. So, on the second hand, substance use often exists together with psychiatric disorders, and when they are present together, it reduces the effectiveness of treatment of both of them. And substance use also helps in maintenance of symptoms of mental illness. So, taking care of substance use is very, very important as far as mental illnesses are concerned. So, if we do strategies for reducing or eliminating substance use in patients with mental illnesses, it will greatly improve the psychiatric treatment outcomes and overall well-being for them.
Then how can you, what measures do you suggest for substance abuse to be managed?
Ideally, I think any kind of substance use should be avoided. But if we talk about managing them, first step should be assessment of how much is the intake. So we should understand whether the substance use is occasional or is problematic. So we'll call it problematic if the substance use is causing any impairments in his life, whether work life, family life, or causing any harmful impact on his life. So then one should decide for taking any appropriate intervention. So interventions can be in the form of seeking professional help from mental health professionals, taking pharmacological treatments or counseling or behavior therapy. So all these sorts of helps are available. Another important step in management of substance use is, I think, stress management, because stress is often the reason for relapse of substance dependence, and also it is the reason for maintenance of substance dependence. So stress management is another important aspect of substance use management.
Now, a lot of lifestyle factors, as you said, are emerging,
Yes.
especially with digitalization.
Yes.
Especially, we are talking nowadays of the screen time use and mental health. Now, how can this excessive use of screen, whether it is computer, laptop, iPad, or even phone, does it really impact mental health?
It's a very relevant question for today, I think. So as we all know, ma'am, that screen use is a part of our lives now, whether starting from childhood, it works as a toy for children. Then as you go to school, it forms a part of lectures and online classes. And then as we go to professional courses for research and studies, we use screens, and it also is a source of our entertainment for day-to-day life. So, but it has its negative impacts. So if we talk about physical health impact, increased screen use is associated with sedentary lifestyle. It is seen that people who are engaged in screen a lot, they tend to be sedentary. They eat a lot, specifically at night. They have a poor sleep quality, poor immunity, and a lot of other illnesses. It also has mental health impact. It has been seen that increased screen time, especially social media use, has been linked to illnesses like depression, loneliness, social withdrawal, etc. So it also has significant impact on our sleep because of the blue light that is emitted. It disturbs our sleep rhythm, and also that way also it has a significant impact on our mental health. So if we optimize the screen time, we may improve sleep, physical activity, and it will help us in achieving a better mental well-being and overall health.
How can we optimize the use of screen time?
So,
It's a difficult question, but there may be some small tips which you can do so that it can benefit us.
So I think we can monitor our usage to start with. So there are a lot of, we should not use screen for monitoring use of screen, but we can limit it to daily screen time unless it's essential, like for workplaces or educational purpose. So we should limit it to those settings. Also, we can, so there are some practical steps, like we can have no screen zones or no screen periods at home, like during meals, or like having a family conversation, or when we have guests at home, or we are playing outside. So this should be declared screen-free zones or screen-free periods. We can use screen strategically for our benefit, like if we consider mental health and illnesses, we can use screen or devices for tracking our health activity, how many steps we have walked, how many calories we have consumed, to schedule our medication alarms. And so these are the ways screen can enhance our productivity. Also, most of the devices will have blue light management system, or we can use blue light glasses and avoid screen at least 2 hours before bedtime. We should also give preference to alternative activities, like as I said, we should prefer reading physical books than e-books, should engage in sports activities outside than mobile games, and should engage in mindfulness practices for relaxing. So these are some of the strategies, I think, to optimize screen use.
Also, as we said, that sometimes it's not possible, when you are working in a very managerial job or in a corporate sector, to reduce the screen time, but at least the continuous screen time maybe can be reduced. For example, if you're doing a desk job on a computer, then after every half an hour or 45 minutes, you can get up and take a round. You can go to leave your file in the other room, which will also help. It is a kind of the forced, very minuscule but still a forced physical activity. It helps you stay away from the screen time continuity, so you have your eyes focusing in the longer range than the short range. And so these are some of the ways which, if it is not possible, at least this much amount can be done. Now, are there any other lifestyle factors that you would like to share which may be relevant to mental health?
There are a lot of factors and they are emerging as we speak, but few of them come to mind now. Firstly, I think another important lifestyle factor is social interaction. So again, one of the drawbacks of a lot of social media use and screen use is that social interactions are reducing. So having a strong social circle and support system helps reducing stress, promotes emotional well-being, and lowers the risk of at least minor mental problems, depression, anxiety, and stress. On the other hand, it is said that there is evidence that structured social interactions, they also form a part of treatment process in psychiatry. So structured social interaction is used as treatment for depression and even for certain severe psychiatric illnesses. So this way social interactions are very, very important. Other lifestyle factor which I can think of is environment. So environment here I would mean the surrounding of our homes, our workplace environment. So spending time in a nature free of pollution and ample sunlight helps you relax, lower stress, and even boosts your mood. Healthy and clean environment also improves our focus and concentration. So it also increases our efficiency and overall well-being. Another emerging and important lifestyle factor is work-life balance. So a lot of these lifestyle factors are overlapping, but work-life balance is another thing which nowadays is important because everyone is working, and too much work stress can lead to exhaustion, anxiety, and mental health issues. So certain practical tips like setting boundaries, increasing efficiency while being at work, taking shorter breaks during work, and doing activities that you enjoy, that is hobbies, they can help you a lot in maintaining a healthy balance between work and life. Another important positive lifestyle factor I would say is mindfulness and spirituality. So practices like meditation, yoga, or other spiritual activities, they help you relax, stay calm, and manage your stress more optimally, and they also help you build your mental strength. One other factor which I can think of is, I think, posture. Nowadays, a lot of bone and spine issues are occurring even in younger age because of not being able to maintaining proper posture while sitting, standing, or at work. So occurrence of such illnesses at earlier age can also increase the risk of mental health problems later on. So I think maintaining a proper posture during the whole day is very, very important lifestyle factor.
So we have gained a lot of knowledge today regarding the interrelationship between lifestyle factors and mental health and disease. We learnt about the impact of physical exercise, diet on the mental health, how sleep, hygiene, and reducing stress can help alleviate the mental problems, and also so many newer lifestyle inputs, lifestyle changes that you have said. Now in the end of the session, would you like to give some take home messages?
Yes. So I think we have discussed that mental illnesses and lifestyle factors are very, very significantly related. Certain lifestyle factors like physical activity, sleep, diet, then stress, screen use, substance use, these are very, very important lifestyle factors. And if there is a problem with these lifestyle factors, it can contribute to causation of mental illness, or it can worsen the already existing mental illness or creates problem with management of this mental illnesses. So very, very practical steps like engaging in regular physical activity, maintaining a proper diet, optimizing our screen use, avoiding any kind of substance use, having a healthy work-life balance, and engaging in practices like yoga, meditation. So all these simple practices can help us a long way in maintaining a healthy and overall a very, very productive lifestyle. Thank you.
Thank you so much. So we have learned a lot, and I think these are very small tips that you have given. By lifestyle modifications also we can to large extent prevent ourselves from getting into mental diseases and maintain a good mental health. So with this, I think I would again thank you for coming in. Thank you.